So if we look at gels, if we look at a gel that's preventive, that's going to help us deliver that amorphous calcium phosphate at home on a regular basis, let's talk about the Enamelon. The Enamelon has a stabilized stannous fluoride. And when we think about stannous fluoride, some of us probably think really great things because it is a good fluoride, especially for anti-caries, gingivitis, etc. And look at that amount, 970 parts per million. Versus the much higher levels of fluoride with some of these take-home products. So it's formulated to deliver the amorphous calcium phosphate in a stabilized stannous fluoride mode. One thing I like about the Enamelon preventive treatment gel is the size of the dispense cap actually. So it's smaller than most, so you don't risk over using the gel, using too much of it. So it's more measured. But we know that, again, the stannous is really the gold standard in preventing caries. And it supercharges dental sealants, which we'll talk about in just a few minutes. One very nice aspect is it's safe on children of all ages, and that's important. It also relieves dry mouth symptoms and also works to help prevent and treat dental sensitivity. As I said, we can use it on children of all ages, which is a nice aspect, but we want to make sure, and the ADA and the CDA recommendations are very small portions, if you will, right size on children under 3 and 3 to 6 years of age, more like a pea size. And I think many of you have seen children certainly overuse that. We need to be careful with fluoride products. Another really great aspect of the Enamelon preventive treatment gel is the ultra-emulsion aspect. So it contains a siloxane-based ingredient, basically contains 2 copolymers which reduce surface tension. A lot of times people that use this, myself included, feel like a slickness across the teeth. This reduces dental plaque adhesion. So it alters the dental plaque structure. It gives the really smooth, clean feeling, increases substantivity of the product, so makes it more sustainable, and encourages the sustained release of its ingredients. So the ultra-emulsion is really a neat aspect. It also helps with xerostomia, keeps the mouth and the oral tissues moist and slick, and that's a really nice advantage of this particular product. This is a great picture of the stannous fluoride delivering the ACP, and what it's doing is occluding those dentinal tubules. And hypersensitivity is all about open tubules. And you can see on this picture here of the scanning electron micrograph the difference. And one is after 5 days and 10 applications, and you can see on the right that those globules, if you will, of fluoride are blocking those tubules with the help of the stannous fluoride and the amorphous calcium phosphate. It's a great product for all those reasons. As far as enamel solubility, and we talked about this at the beginning, we don't want enamel to be soluble. So this product really helps to increase that and really fights against enamel demineralization in that sense. Comparing it to 2 other products here as far as the percentage of enamel solubility reduction.